Welcome everyone to the Coalition for Marriage YouTube channel. It's a real privilege to have with us today Dr. Julie Maxwell, who some of you will know. Julie, would you like to say hello?
Yes, I'm Julie Maxwell. I'm a community paediatrician who I work part-time, and I've got 3 of my own children, all teenagers, and I've been married for 23 years. I also work for 1 day a week for Lovewise, which seeks to promote marriage and teach sex education in a way which is much more healthy for children than a lot of the sex education that goes on. And in the process of doing that, I've also become very interested in the whole issue of gender identity and all the issues that go along with that.
So as a clinician, does it really matter, do you think, whether a child grows up with their biological mum and dad or not? Isn't the only thing that matters that they grow up in an environment where they're loved?
It's a really interesting question, isn't it? Because obviously, love is hugely important, and there are children that grow up with their biological parents but aren't loved and are significantly affected by that. However, biology is hugely important, and you only have to look at children who are adopted, for example, or who never know their biological father, which is quite common, and those children, no matter how much they're loved, they always want to know where they came from, and they always want to know, who their parents were, and so clearly biology is hugely important as well as love.
Does it really matter to a child how many times one of their parents changes partner?
I mean, I think it affects it hugely. Very often I see children in my clinics who are in exactly that situation where they may have, a mother or a father who loves them very much, but has a series of relationships. And, and these children, they need the stability of having a mum and a dad. And often what you see is that mum will get a new partner, the child will get attached to the new partner, and begin to feel quite stable, and then the partner moves on and somebody else comes along, and that is really upsetting for children. It's really disturbing for their development, both physically and emotionally as well, because children, they need stable relationship.
Building on that, this idea of stability when it comes to gender, stability when it comes to a child's sexuality. What's wrong essentially with teaching kids about gender change and gender fluidity? Shouldn't we teach all our kids to be accepting of everyone?
I think it's a really big problem, particularly in the current situation where children are often being taught about this very, very young, when children will accept whatever they're taught to a certain extent, and they accept it in very simple terms. And so if you teach a child that they can that if they're a girl but they can become a boy, they will believe you, because for that, as an adult, if you've told them that, they will believe that. And of course, we as adults know that you can't biologically become the opposite sex, no matter what kind of treatment you might have. That's never going to happen, and children can get really confused by that. And I think when you're trying to teach children as well about same-sex relationships, again, that can be really confusing, because it's one thing for children to know they exist, and to be accepting of people, but actually to teach children that a child can have 2 mummies, well, a child can't have 2 mummies. You've got to have a sperm and an egg to make a baby, and so but children will then grow up thinking that actually 2 women can have a baby, or 2 men can have a baby, and we know that biologically, without medical intervention, that is not possible. So it's really dangerous giving children these ideas at a very young age. That's completely different to just teaching children to accept people. It's teaching to accept concepts which are actually not true.
I'm just wondering if in your clinical experience there's any influence on people's own relationships later on in life, which can be affected by teaching of gender fluidity at a very young age.
Relationships are complicated things, and the big issues for the kind of future relationships in the whole gender issue as well is that if you are brought up to think that gender is fluid, that you can choose who you are, then that makes relationships really complicated. If you're non-binary, or you think you're non-binary, do you go out with a boy, do you go out with a girl, do you go out with, if you're a boy but you think you're a girl, then do you you know, are you a lesbian, or, you know, and it gets hugely confusing. People get very cross about it when, for example, say lesbians say, well, I'm only going to have a relationship with another woman, not with a trans woman, and then they're deemed to be homophobic or transphobic. I mean, it's just hugely confusing. You know, relationships are confusing enough at the best of times, especially for teenagers. But when you get kind of confused about your gender and your sexuality, then, you know, how have you got any hope of having a normal relationship?
There's obviously a lot of talk in the media at the moment about drugs and therapies and even surgery for very young children. As a clinician, what's your view on that?
I mean, my view on that is that children are too young to make decisions that are going to affect their future, and we kind of all know that. You know, we don't let children spend all day playing on PlayStation or eating chocolate or eating McDonald's, because we know that it's not good for them, but we know that that's probably what they choose if they chose. So we spend a lot of our time as parents and as professionals kind of telling children what's best for them for their future. And yet in this situation, we seem to be allowing children to make decisions, which seems to me utterly wrong, because, you know, a child, particularly a very young child, but even a teenager, they don't really know what they're going to feel like in 2 years' time, 3 years' time, 10 years' time. And to allow them to undergo medical and surgical treatment, which is going to affect their physical health, their mental health, their sexual functioning for the rest of their lives, seems to me to be utterly unethical. That, you know, they can't possibly be able to consent, give fully informed consent for something like that.
Have you got a view as a clinician about whether that means we should teach more sex education and teach it better?
What seems to get taught in schools is that they seem to think that if you just give kids all the information, then they will make the right choices. So that goes back to kind of what I said just now about you know, junk food and playing PlayStation all day. You know, children, they know these things aren't good for them, but they still choose to do them because children think that they're invincible. And I think sex education is the same. And if you just give them a whole load of information, and the kind of the trend is this sort of sex positive education where you teach them about how, you know, how good sex is and how which obviously it is in the right context, but you just give them this information, and then you tell them that so long as everyone's consenting, that's fine. But what is consent? You know, how can you consent to something that you don't fully understand because you're not old enough to? And also, you know, schools are not giving all the information because they are not telling children about the impact of future stability of marriage. That if you live with somebody, you're less likely to actually stay married or stay together. They're not telling them about the emotional impacts of casual sex. They're not telling them about potential issues around, you know, if you get pregnant and then have to have a termination and the impact that might have on you physically and mentally. They say they're giving all the facts, but actually they're not. People just assume that teenagers are going to be sexually active, rather than even giving them the option. And I think that's what strikes me when I go into schools and talk to children and teenagers, is that they can sometimes articulate actually what might be good about saving sex for marriage, because I will often ask them that question, and they will articulate that, you know, it makes it more special, that they'd be able to trust the person more, but the expectation that they will be able to wait till they're married just doesn't seem to be there.
As a medic, you're not necessarily qualified to answer this, but I'm just curious, what's going on? I mean, if it's quite clear that marriage is really good for couples, growing up with your mum and dad is really good for children, that lots of sex education makes kids have lots of sex, that trans ideology is not really healthy for young children to learn about and certainly to go through in terms of medical experiences. What's going on that we seem to want to teach the negative and follow after that and kind of ignore the positive, the evidence-based positive?
Very good question, I think. So I've had parents have said to me, you know, you're going to teach my child about marriage. Are they going to feel bad that you know, that their parents aren't married, that, you know, I'm a single parent? And I said, no, it's not about that. It's about teaching them that, that what they can have, and usually the parents will then say, well, actually I want them to get married, I want them to have a happy marriage. I mean, you can be even more cynical, can't you, and say, there's a deliberate attempt to undermine marriage and undermine society. And you look at something like No Outsiders, where it's about smashing heteronormativity. That's destroying the family, isn't it?
It is, and you've got to wonder why somebody would want it not to be normal that a person grows up with their mother and father and then marries a person of the opposite sex. What's wrong with that being normal? It's how we develop and how we go forward as a human race. It's a tough time for kids at the minute, tough time for parents. What advice would you give to parents when they're looking to provide the best environment for their kids to grow up in?
Particularly for married couples with children, I think the big thing is to prioritise your own marriage, because you can't show marriage in a positive light and be that stability for your children if you haven't prioritised your own marriage. And I think our society too often encourages parents, I think, to put children at the centre, which obviously children are hugely important. But unless your marriage and your relationship with your husband or wife is prioritised, then the children are going to lose out. And I just think being there for your children is way more important than society gives credit for. I think our society talks an awful lot about quality time and doing quality things with children, and actually sometimes it's just about being there and doing normal things and being available.
I know you're very, very busy. Can I thank you for all the work you've done, all the work you are doing? Please keep it up. You're making a huge difference, and thank you very much for your time today.
Thanks, Tony. Bye.